stigma manifestations undermine our access to resources. So for example, they can prevent people from accessing treatment or from accessing employment. They make social isolation worse, and they lead to psychological responses like depression, stress, and avoidant coping. And then together, these mediating mechanisms can lead to substance use and undermine treatment and recovery outcomes among people with substance use disorder or in recovery. And among people with substance use disorders specifically, including those who are in treatment, we also see some evidence that stigma is associated with more substance use and higher risk usage of drugs and experiences with overdose. Stigma is also cited as a primary barrier to substance use disorder treatment.
So we examined 46 images that were taken from sort of the top papers and news sites and resources available nationwide, and had our patients, had our individuals with lived experience really respond and engage and help us set the do's and don'ts, and really also share their experiences with images that either reinforce prejudice and stereotypes, images that they felt were stigmatizing, as well as other tracking other themes that emerged. Scrabble tiles and the molecular symbols or dictionary examples of whether it's cannabis or stimulants or opioids or heroin was the recommended option for individuals with lived experience, as opposed to really negative images that you see very frequently.
When we're communicating a message around support and help, it actually is very powerful when you're trying to have marketing material or things that talk about access to treatment and support for individuals who may be struggling with going into treatment and that support, because the picture is showing definite support and care. And it also works really well with legislators when you're providing material to their office, talking about increasing access to treatment funding. You're actually talking about providing people with support instead of focusing on the issue or the substance. You're actually focusing on the care of the people. Feedback that we received was definitely impact on diversity, because we continue to show this disparity, and part of treatment, especially for marginalized and oppressed communities, access to treatment, engagement in treatment is a lot of times not having access to people who look like them and who have experienced some of those same things, which is why we push peer coaching as well.
On the recovery side, utilizing photos of health, of togetherness, landscape photos of nature work really well. We've had really positive feedback to helping to pull someone up the mountain or the hill, which is showing sort of social supports and progress and feels very hopeful and inspiring. The don'ts include images of people using substances, images of people looking very sad or isolated or forlorn, to sort of keep representations of treatment really positive. Anyone in handcuffs, that's not their best day, and it's not the right way to portray an individual as either going into the criminal justice system who have a substance use disorder. Avoid images of bars, lines of cells, barbed wire, individuals in jumpsuits, any hands on bars that can feel very dramatic and powerful for clickbait, does not invoke good feelings for individuals in recovery or that have justice experience.
So if you or your colleagues have research ideas for how we can reduce stigma, or what are some novel approaches to decreasing stigma in order to facilitate prevention, treatment, and recovery, we want to hear your best ideas, and we're very interested in supporting work on these topics.